So today I'm going to be treating the thigh with the Enraf Nonius Tecarpuls. I'm going into hamstring contusions. You'll see it's pre-selected the highest output of the machine, level 10, and 7 minutes. I like to use 1 minute per treatment head size. I'll be using the large treatment head for this. There's many different places in the hamstrings you can treat. I'm going to do this as an example just in the centre of the hamstrings here. So you could say we're across the whole of semimembranosus, maybe semitendinosus. You could even say that we came out onto biceps femoris. Obviously you wouldn't do this in normal treatment. I'm just applying the contact medium to the earthing electrode here. Yeah, in normal treatment what you'd probably do is focus on the worst area. So for most people this would be the tendons, either at the knee or up at the origin at the pelvis. And if you were doing that sort of area, you wouldn't need anywhere near the amount of time that we've got pre-selected here. So if you were doing the tendons across the back of the knee, you'd probably be only doing semimembranosus tendinosus or biceps femoris. Just as a demo, you see on the thermal camera, we've got about 29 degrees, just over 29 degrees here on the back of the thigh, on the hamstrings. Yeah, if you were up at the pelvis, then obviously the origin of the hamstrings, you wouldn't need that many minutes at all to put heat into that area. I'm just going to come across semimembranosus, semitendinosus here, and just do some treatment down the back of the hamstrings into the muscle mass. I'll just work around in small circles. Like I say, many different places you can actually do this treatment. This is just an example, but as an example, this would be fairly common for somebody who'd got a mid-substance tear of the muscle, maybe got a bit of scar tissue developed here. You might find that this area is just a bit thickened. It doesn't want to stretch out as much as the other parts of the hamstrings would. Fairly commonly use this treatment in chronic hamstring problems, not acute hamstring problems. So this wouldn't be something that we would do in the first couple of weeks following a hamstring tear. I'd definitely leave this for later down the pathological process. As I say, this would be an example of doing this onto semimembranosus, semitendinosus for someone with a mid-substance problem. Most problems in the hamstrings, in my experience, are not really mid-substance, so either high or low. But you do find mid-substance problems in sprinters. It's not unusual to have a lot of bruising. If you get a mid-substance problem, it goes down your leg, just follows the bands of fascia down your leg, and will settle in the lowest band, so down the leg as far as it can in that band. And you'll see a lot of bruising in acute hamstring mid-substance tears. This is a long treatment, so I'll fast forward here to the end just to give you an example of how you would expect the heat to come up in the muscle. Remembering that for each degree centigrade we bring up the temperature, we'll get increased healing. So I'll fast forward to the end and we'll see what the thermal camera says. So here we are now back at the end of the treatment. You'll see there's some redness, some erythema, some flushing of the skin. I'm going to bring the thermal camera back in so we can have a look and see how the Tecar has increased the circulation to the area, increased the temperature within the area, and see what sort of results we got. It's usually pretty dramatic Tecar onto muscles even after a minute or two. So if we have a look here, we're up in the high 30s, 37 degrees. You can just see from the thermal map the heat that the Tecar has developed very locally. Good treatment.